These next couple of tests, we have 3 of them we're going to be doing for a labral tear. Remember, there's 2 main labral tears that we're going to be looking at. One is called the superior labrum anterior to posterior, and the other one is called the Bankart's lesion. Just remember those. These tests aren't really specific for one or the other of those, they're just for labral tears. Of course, any type of adhesion, any type of lesion, any type of breakdown in the joint could cause positive, but the tests are geared primarily to try to pick up a labrum if you have a problem. The first test we're going to do is Crank's test, and what we're going to do is we're going to abduct the patient's arm up above 90 degrees, and you want to be like between 90 and 110 degrees. And what I'm going to do is stabilize here. I'm going to put pressure axially right into that joint, and then I'm going to do internal and external rotation. And we're going to see if we can't catch that labrum on the humeral head there. So that's Crank's test. And another test that we're going to do is called O'Brien's test. And I'm going to have our patient stand up for this one, please. In O'Brien's test, what we're going to do is we're going to have our patient bring their arm up, their shoulder, we're going to flex it to 90 degrees, and then we're going to move it medially about 15 degrees. Then we're going to internally rotate it. Now what we're going to do here is we're going to stabilize, and I'm going to press down, and they're going to resist. Now, the patient may have some deep pain in here. If they do, that's indicative of a labral problem, but it's more superficial, maybe an AC joint issue. But we press down on here, and the patient says that really causes them a lot of discomfort. We're then going to keep it in that same position, but we're going to fully supinate it, and we're going to press again. When we press again, they may still have pain, but the pain should be diminished. If the pain diminishes, then that's a positive that, hey, that severe pain was coming from that labral tear. The next test that we're going to do is called the anterior slide. And so with this one, we're going to have the patient bring their arm backwards a little bit, and they're going to just rest their hand just like that on their hip. Now what I'm going to do is I'm going to have them just relax here, and I'm going to just stabilize here right up onto the scapula as much as I can on the scapular spine, etc. And I'm just going to push actually right up into there, just like this, and the patient's going to resist while I'm doing this. There you go. And that's called the anterior slide. So you're looking for any type of clicking or clunking, popping. These are the kinds of things. Sometimes somebody has a labral tear that have this painful catching. But they're the 3 different tests that you're going to be doing for labral tear.